All right, welcome to today's webinar about the Exopulse Mollii Suit. My name is Frida Hurtig. I'm a licensed physiotherapist, and I have been with Ottobock for 1.5 years now, working as a key account manager and market access manager in neuromobility. Another interesting thing about me right now is that I woke up without a voice, and I really hope that it will last these 45 minutes. I have with me a special guest today, the very reason that we are sitting here, and the man behind this amazing medical device. So the inventor and the founder of INN, Fredrik Lundqvist.
Thank you for that nice introduction, Frida. Yes, as mentioned, Fredrik Lundqvist, inventor of Exopulse, and been working relentlessly to get this beautiful product out on the market the last 15 years. So I'm going to tell you a little bit more about the story. So yes, let's get started.
Yeah, exactly. This is the first picture that we have of you, I think. Can you tell us a bit more about how the journey began and you got this idea?
Yeah, as you maybe can see, this picture is quite old. It's over 20 years old, this picture. It is me and Jurek Romansky, which I worked with for 8 years. He was a man with primary progressive multiple sclerosis, and I could see how awful this disease can be for people affected. I could see the different stages in a primary progressive progression of the disease, and that was also why I could find the method. So in this picture we can see that Jurek could still eat by himself, chew. He could also grab a glass and drink by himself, and this was the year 2001. And after a short while, after this picture, he lost all his abilities. He could not talk anymore, and he grew very ill. He got a peg, also a suprapubital catheter so he was really, really in bad shape. A lot of medication, and not to forget an increasing spasticity that made him totally paralyzed, quadriplegic, and it made it quite difficult for us to handle him. So it was impossible to almost bend his knees, taking the leg, the way you would think you should bend a leg. And I found a trick or a maneuver that made it much more easy. So if you bend the fourth and the fifth toe down and you turn the foot a little bit in supination, it is much easier to bend the knee and the hip. Which is very, very important if you want to take care of someone who is seated, where you want to have 90 degrees in the hip, 90 degrees in the knee, and also if you want to handle someone who is lying in a bed. So I taught the other personal assistants, that's called if you are assisting someone in the home environment, I taught them this and didn't think about it more. So after Jurek passed in 2007, I worked with other people with disabilities, and I could see this reflex was there also in them. It was possible to evoke this reflex also in them. And then I started thinking about, what if we can produce this reflex artificially? And what happens when we bend the toe? What is happening? How can we explain that it gets easier to bend the leg? And I mean, the extensor spasm has to be deactivated, inhibited. And the bending of the knee has to be activated in any way. The same for the hip. So the front of the hip would be activated, and the back muscle or the muscles in the gluteal muscles would be deactivated. So I thought, what happens if we help these muscles that get activated with a current, with a small current with 20 hertz, 20 volts? And this was in 2009. And I did an experiment where I put an electrode on the hip, one on the hamstring, and one on the lower leg to lift the foot. And after 20 minutes, it was much easier to bend the knee without the reflex. But with the reflex, it was almost like pushing the clutch in a car. You would take out the gear. And that made me think, I could reduce spasticity with electrotherapy. And the next time, 22 muscles, 44 electrodes, 1.5 hours to put it there. A lot of work. And then a total relaxation of the body, even fell asleep. So I thought, oh, now I have to teach this to physical therapists. They have to glue electrodes, 44 electrodes on the body and do this. And it didn't look good. I mean, there were cords everywhere. You could not do physical therapy at the same time, but the efficiency was good. And then I thought, what if we could place these electrodes inside an anatomically tailored suit so they would be in the right place and we could choose which ones to stimulate? And that's where we are today. So now we have a suit, and you can explain a little bit more about it and also the users.
Yeah, of course. This is what the suit looks like today. So this is the world's first neuromodulation suit that uses transcutaneous electrical stimulation to reduce spasticity in muscles while enabling activity in weakened muscles, and also for reduction of pain. And this can lead to a more active and less painful everyday life for these people. You often see the Exopulse Mollii Suit together with the slogan that you see here, put on the impossible. And I find it quite fitting, because when you meet these patients and you help them put the suit on and you turn on the stimulation, and they actually don't have to do anything at the time. They can just relax in bed or in their couch. And after this hour of stimulation, you see these differences in their body, that they can move much easier, or they can do activities that they couldn't before. And I find it quite impossible at sometimes when we see this kind of changes from not doing anything. And at the same time, of course, it's better if you do it together with physiotherapy, but it's quite nice invention that it's passive and very friendly to the body as well. This girl that we saw in the picture and the video that we will show now, her name is Leah, and you know Leah quite well.
Yes, actually, I met her the first time she tried the suit. I did her fitting the first time in 2015, and her father and her mother were also present. And a really interesting thing is that we did also a lot of other tests. So Nicolas Abu, who was the father of Leah, he was totally amazed about the efficiency in his child, but also what he could see. So he turned into a complete believer of the suit. He even funded also research later in the suit to get it into the system. And yeah, we can see how it affected Leah positively, and she explains it herself in the video. And Nicolas is later also the CEO. So he started as the CEO in 2018 and has really made a difference also, and made us also part of the Ottobock family. We are a subsidiary of Ottobock now.
Okay, let's watch this video.
Jag älskar sport. Jag gör basket, rider, jag gillar att åka go-kart och skidor. Jag heter Lea och är 10 år. Jag föddes med en CP-skada och nu har jag snart använt Mollii-dräkten i 4 år. Första gången så kunde jag inte sitta med benen i kors och rak rygg samtidigt. Och med min högra hand så kunde jag bara vinkla så här, och nu kan jag vinkla så här. Mollii hjälper mig väldigt mycket med min balans och att jag kan gå mycket längre. Jag kan stå mycket längre och då kan jag göra mycket mer saker som att laga mat. Jag gillar att göra det. Nu när jag använder Mollii så behöver jag inte göra botoxing, så jag är väldigt glad. Och nu behöver jag inte ta lika många smärtstillande och någon gång inte alls. Det känns som en ny frihet. Det känns som jag är en ny människa på ett sätt. Helt fri. Kan göra vad jag vill. Och det känns väldigt bra.
All right. So by watching that video, I think you get a nice a deep dive into what it can be for a person. So in Leah's case, she describes different effects that she experiences from that she can supinate her hand in a better way, to that she can stand up for a longer period of time and perform hobbies that she couldn't do before, like cooking and so on. So it's a good video to see this early on in the presentation. But now let's have a closer look at what the suit actually is. So I told you before, it's the first full body neuromodulation suit. It consists of a jacket, pants, and the control unit that you can see on the picture is attached to the belly. It has 58 embedded electrodes that are sewn into the suit, and they can stimulate the entire body, more or less, over 40 key muscle groups for a beneficial movement pattern. The stimulation is a sub-threshold stimulation, 20 hertz, which means that it won't make your muscles contract, but it will more or less get the muscle ready to contract. When you do the programming for each individual, you can tailor it to their needs. So for every person that you meet, you can do completely different settings to make sure that you meet their individual needs. Once it's fitted and it's programmed and it's done, and you use it by themselves in their home environment, it's very easy to use. You basically put it on as a regular pair of pants and a jacket, and then you press on and you press start. And then the programming will continue for 1 hour. You don't have to do anything more. So it's super easy to use once you have it fitted and done. We've also seen that the effects of wearing this suit for 1 hour can last up to 48 hours. So it's enough for most people to wear it every other day. So that's a common misunderstanding or a question that we get sometimes, like, how can I wear my clothes over this suit and so on? But you don't have to do that. You just wear it for 1 hour, and then afterwards you can continue with your day. Another question that we get is, do you tailor the suit, the textile, the suit? And we don't do that, but we do have a lot of sizes. So 37 sizes. It starts at 104 up to 5 times XL. So from like a 2-3-year-old or something up to 5 times XL. And that last bullet there is the contraindications. So if you have an active implant of some sort, for example, baclofen pump or a shunt or a vagus stimulator or any kind of implant that can be affected by magnets, then you cannot wear the suit. That's also important to remember. What about what happens in the body? Like, how does the suit interact with the nervous system and the muscles, Fredrik?
Yeah, this is very interesting. I mean, the concept of reciprocal inhibition granted Sherrington the Nobel Prize in 1932, I think it was. So this reciprocal inhibition has been known for a long time, and easily described, it is if you activate a muscle at the same time the antagonist is deactivated. And we see this in the loop. First, the activation blinking in green, if we push one more. And then after this activation, the signal goes to the same muscle, but at the same time, it deactivates the antagonist. And this is what we are using. And I really like that you used the programming was going on for 1 hour, because if we want to explain the prolonged effect, it's a kind of programming, training of this monosynaptic loop and reciprocal inhibition. So these synapses get actually better to fire thanks to our method. So we're training reciprocal inhibition in the individuals that use the suit.
Correct. What about what kind of patient groups should we be looking for when it comes to searching for a good candidate to use the suit?
I mean, the key intended use is the relaxation of spastic muscles. And in 2 groups where we see a lot of spasticity is cerebral palsy, multiple sclerosis. So we have a lot of spasticity sufferers, so to say, in these groups, but also, of course, stroke sufferers. So we have tried it mainly during the years, 15 years now, in people with spasticity. And of course, you can also get spasticity by other injuries to the nervous system, to the central nervous system. For example, after a TBE infection, you can also get spasticity, traumatic brain injuries, also often followed by severe spasticity and quite quickly after the injury. So this is the common use, spasticity. But we have also seen that it can help activate the muscles in these palsied patient groups.
Yeah, and these patient groups are the ones that we have the most evidence for, that we've done the most studies on. So besides the relaxation of the spastic muscles, and that we can also activate weakened muscles and re-educate them, you can also see in these studies that we can maintain or improve the range of motion. We have also seen that we can increase local blood circulation. And then the last one there, the symptomatic relief and management of pain. All right, so these three patient groups that we mentioned on the slide before here, so CP, MS, and stroke, we now will show you some videos for just to give you examples of what the effect can look like for these patients. So this is a bilateral CP, and when you watch this video, know that the left-hand side is before the 1 hour of stimulation, so before the suit has actually been activated. And the one to the right is after they have had this programming on for 1 hour. So you can start by looking at the left side. So you see this boy, the task is to sit with his legs crossed and to find his balance in his core muscles, and just to make it even more difficult to raise his arm there at the end. So you can see how he's struggling. He's trying to sit in a good position, but he can't really get his knees to fall down to his feet. So it gives him a quite unstable position to sit in. He also has trouble finding his core muscles to get a good posture and a stable posture. And the lifting of the arm is super difficult for him. If we have a look at it again, and then look at the right side of the video, you can see what happens after he has gotten this stimulation. So you can see his knees are all the way down to his feet. He sits in a very stable position. He has better contact with his core muscles, and he can actually raise his arm for quite long. So just imagine the difference from not doing anything actively. This is like a medical device that passively gives you these kinds of effects. And also imagine what it can do for his motoric development through the years. And then he can sit like this and play with toys or play with his friends and so on. It's quite amazing. This next is also a bilateral CP. If you look at the left side, you will see the spastic muscle, the calf, and how it's very hard to get his heels down to the ground. And if we look at it again and have a look at the right side, you can see that this person's heels are all the way down to the floor here. The next one is a stroke patient with the left side affected. Same here, the left video is before stimulation, so the right side, she doesn't have any troubles flexing the hip there. But you can see how she is struggling with the left side. It's hard to find activation and strength to even get her feet to leave the floor. If you have a look at it again, and then on the right side, you will be able to see that it's quite a difference when she lifts her left leg here. She is also more able to keep her balance. So it definitely does something to her entire body, but the strongest effect that we see here is the hip flexor. The next one is an MS patient, Louisa. I think you know her as well.
Yeah, I met her the first time actually in Leipzig, and I saw this video the first time at a fair. So I was very taken emotionally also when And I was able to see this video the first time, and it was almost like an ambush because I had to go up on the stage and answer questions afterwards. So, but of course, a fond memory. I mean, it's a beautiful video, and it's
quite emotional.
Yeah, we have to say this is a miracle effect.
Yeah.
I mean, if we have to almost give a disclaimer here a little bit, because people cannot expect this kind of efficiency of the suit every time they test it. So it's important also to tell the people that they will see something, and that something will happen, and that they have the expectations right.
Yeah, I will start it, and if you want, you can describe during.
Yeah, I mean, it's really easy also for layman to see here that there is a big difference. I mean, she has to support her walking. She has total autonomic function in walking. Also, the movement with the arms, the cross pattern, we see the cross pattern, especially off the left side. The right side is a little bit still not there, but a happy camper. I mean, for her, she can study. She can now prepare for a day. She can know that she can move. So she goes to the university now, much easier. And of course, also her social life. She can plan to be out and move around. And she could even run for the first time since her disease progressed. So wonderful.
Yeah, it's very impressive. Okay, so if we just zoom out a little bit from like the patient groups and the individuals in that matter, and take a more of a helicopter perspective and see what kind of benefits it can give to caregivers and the healthcare system.
Yeah, I mean, we've actually touched it a little bit with the description of Jurek, what we can do for him. So, I mean, the autonomy is really beautiful that we can give people so they can manage their lives better on their own. And to being able to tell parents that it could be more possible for their children to gain autonomic function for the future is what every parent wants for their children. So this is a beautiful effect. We also see that it's easier to manipulate the joints. It's easier to place a person with severe spasticity in shower chairs, in their wheelchair, or also in a lying position, which ergonomically is a big advantage for people working with them. It can speed up the recovery. So it makes it much easier for the patient to use physical therapy. So we can tell them wear the suit and then do physical therapy, and we can shorten the time where they have to do stretching, for example, to almost no time. So before, the physical therapists had to use part of their time with the patient, sometimes 20 of 60 minutes, to loosen them up. So the efficiency of physical therapy is increased very much. We can also see that these patients have not many options. What options do they have? I mean, the spasticity is really difficult to treat. And since we have Botox, we can, in some ways, save the joints. So and start working with this. But you cannot work the whole body with Botox. And also sometimes you can get immune to it, so it doesn't work anymore. And it's not very nice for the children to get the injections. And if you don't have Botox, if you don't reduce the spasticity, you have to help the body with surgery. So you have to elongate tendons, maybe also do osteotomies, which also have like 6 months convalescence after you have done surgery. So we can shorten the recovery time from these surgeries. But also after, for example, an infection. Sometimes children get an infection and it takes them 3 or 4 weeks to get as soft as they were before. So this is also something that helps them recover very good. And if we look at young stroke sufferers, for example, or also youngsters with cerebral palsy, they want to work. Or somebody who had a stroke, they want to come back to work. And this could, of course, have a big impact on the health or the costs of a society, that we can have people that don't cost anything and they pay taxes. So if we could get them back to work, is also beneficial to society.
Yeah. Right. So if we have a closer look at the evidence or the studies that are ongoing and also completed, what is the status there?
I mean, in this chart or this slide, we can see the we have a little mark, a little star after the studies that are finished. And just to tell you, I mean, we have been talking about this super nice effects. I mean, we see it. We have seen this for 15 years, the nice reactions to the suit. But to capture this effect has not been easy. And when we started doing studies, we were very concentrated on spasticity, which is difficult to measure. And the protocols were not really fitted for our product. But now we have finally learned also to measure activity and function in our patients, which we have seen, as you will mention later, and we have a possibility to capture the effect of the suit, of the Exopulse, much better now. But we also see in the studies that we have done, we see positive effects, for example, in lifting of the foot in children with cerebral palsy. What we saw in the video, we could measure that in the gait lab. Just to give you some examples, in Lithuania, we had a study that showed that it was equally efficient to physical therapy. So,
which is quite impressive.
It's impressive, but think about doing it together. Because we know when we use two methods, an assistive device that works and a treatment method like physical therapy together, it will enhance each other's efficiency. So this is interesting, but it's a little bit not really the evidence that we need to get it reimbursed everywhere, you know. So, but we have learned our lesson. And you will tell us how we did that a little bit. Yeah.
Exactly. So to make sure that we know which patient groups to target and which kind of tests to use to capture the effects, ENN has done this registry study. So what they have done is that they have collected patient groups MS, CP, and stroke. And they have used all of these tests that you see at the bottom of this page. So Berg's balance scale, functional gait assessment, time up and go, 10-meter walking test, both motor function test, and EQ5D5L. So all of these tests, so it's quite it takes quite a long time to do all of these tests, just to make sure that they find out how do we capture the effects the best. And then they have let these patient groups use the suit. So they've done one measurement before you even using the suit, so at baseline, and then after 1 hour of stimulation, and then after 4 weeks of stimulation. So as you heard, in many tests, so we can't tell you about them all, but just to mention a few. So this is Berg's balance scale, and what you see in A, B, and C is the different patient groups. So we have CP, MS, and stroke. And as you can see, is that the trend of these measurements are quite nice. So if they start at group level in the CP group at around 38, after the 4 weeks, they are up to over
40.
Yeah, over 40. I think it was like 45, something like that. So it's quite a nice, like a group level result, quite a nice increase of that effect. And you see the same trends in all these patient groups. And one more example is the pain, how they estimated their own pain levels. You can see here also in all of the groups that the measurement at baseline and the measurement after the 4 weeks, the difference is quite big and quite impressive. So with that said, since this registry is done by ENN themselves or by us, of course it won't weigh as heavily as a study that's been done by an external party. But we have learned so much from this study, how to do really great studies. So if you could tell us some more about the studies that are ongoing right now, the new ones.
Yeah, so the protocols are set now since we really know how to measure the efficiency. And to just take us to this slide quickly, because we're about at the end of the time, we have 4-5 centers sort of where there's studies been done. So in Henri Mondor in Paris, in Hanover for children with cerebral palsy, and Mayo Clinic in the United Emirates, so in Abu Dhabi, and also at the Mayo Clinic in Arizona. And so to just tell you, we have all patient groups that we were talking about covered. So MS and stroke we're doing at Henri Mondor. We look at function and spasticity So activation of the muscles function, and we check chronic pain. So in fibromyalgia at Henri Mondor, but also in Abu Dhabi. So we can also put these results together. So we use the same protocols. So we will get a lot of power in these studies. So also worth to mention back pain studies, or one study that we're doing at the Mayo Clinic in Arizona. And it's actually also at Henri Mondor. So we're really checking if we can improve back pain also in these patients. So we even have an extra group, or we could call the pain group an extra group. So we really hope that these studies, when they are finished, will give us more solid evidence. So we really can also try to get it reimbursed in more markets, and also make people, also scientists and key opinion leaders, believers of the method.
Yeah, great. All right, so that was the things that we were planning on telling you guys about today. So now it's time for the Q&A. I will try to open up the chat here to see if you have written down any questions for us. I don't seem to see any questions so far. Maria, do you see any questions? No. So if you want, you can, of course, also unmute yourself and ask us your questions. Or if you want to use the chat, you can do that as well. There is one question that I know often comes up, and that is, can you wash the suit? Since it's a garment, can you wash it? You can even wash it in a machine, but you shouldn't do that too many times. The warranty is 2 years, but it's also 25 machine washes. So that's good to know. We use steaming cabinets, and that you can do unlimited time to make sure that it's clean. But since you only use it for 1 hour and you're quite still, I mean, you can, of course, do the dishes or whatever you need to do at home, or you can just lie on the sofa, but you don't get like sweaty, or you don't use it outdoors. You don't really make it that in need of washing in a machine. So in most cases, it's not really a problem that you have these few washes for it. You can also hand wash it, of course.
I see we have another question here, which is very interesting. I would love to answer it. Is the ready to contraction threshold 20 hertz for all the users, for everybody, or does it change per person? So this is a really good question. And the easy answer is no, it's the same frequency for everybody. And I can explain it in an easy way, because we are targeting the 1A afferents. And the good thing with the low frequency, like 20 hertz, is that we only hit the 2A afferents. So we don't get any cross activation of other muscle sensors. So we're only communicating in the monosynaptic loop with this frequency. And it's part of the invention that we are really finding the right neuron that sends the signal back to the spine. And we do that with 20 hertz. The reason why I found this is what I was thinking about, a brain frequency. So when the brain sends signals to activate the muscle, it increases the hertz value. And at 45, it's a cramp. So it's also part of the subsensory threshold, that if we would stimulate with more, then we would risk also activating the muscle easier. So we don't want to do that. We only want to hit the 1A afferents. And 20 is a very good value. And it's because of the thickness of the neuron. So the others are thinner, but the thickness of the 1A is perfect for 20 hertz, that we only hit that one.
Great. I see another questions there, if the electrodes stay in place if people move around. And since the suit is quite tight on the body, they don't normally move around, as long as you have put it on the right way. I mean, we all know that the arm can twist like this. So if you make sure that you have the electrodes that are supposed to be on this side here, when you close the zipper, when it like tightens up, then it will follow your body when you move around. So even children that maybe crawl on the floor, move around a bit more than adults, it stays in place, I'd say. If it's hard to find a size that is perfect, that is tight all the way down, there are also these adjustment bands that you can place over to like make it more tight, to make sure that the electrodes stay in place.
You answered that question well, because you also mentioned that we really have to check that the suit is put on right. So it's very common that the arm is turned and the zipper is pointing to the thumb, which is not nice. So you have to turn it outside. So you really have to check the position of the zippers after you have put on the suit. So that will also give us the knowledge that they are in the right place. Another proof of them being in the right place is that you can see small little squares, not deep indentation, but you can see small squares where they've been when you take it off. So they don't move around.
Nice. Was there any more questions?
Testing period. What would be the testing period that you recommend? And you mean weeks, I think, then?
I think so. I mean, at least I can answer for the Scandinavian markets or the Nordic markets, how we do it here. So normally we have like a fitting that is around 2.5 hours. So we do the examination of the patient and standardized tests, and then we program the control unit and we put it on. They have the stimulation for 1 hour, and then we do the exact kind of tests and the exact same examination afterwards. And in most cases, if the patient is okay with it, we film everything, and we can also show them and show ourselves the differences. And after that, if we see like there's something has happened, we can definitely see a positive trend or an indication that the effect has a good effect. The suit has a good effect on this patient. Then we let them loan them to use in a home environment for at least 2 weeks. So we normally have 2 weeks. If there's a patient that has, I don't know, special needs, that they need more time to get into a new routine and so on, we can grant them 3 or 4 weeks also. But 2 weeks is like the standard that we are trying with right now. And it seems to be working quite well. But it's very important that they get this testing period to try at home. Try how does it work with maybe the assistants or mom and dad. They should be able to put it on, and the daily routines, what time of day is best for this specific person and so on. So they have quite a few chances to try and experiment a little bit on what is best for this individual. And at the end of that period, we have a lot of evidence if this will be something that they will actually use, will have a good effect, or if it will be something that is left on the shelf. So it's very important for us as well. We don't want to hand out the suits to someone where there's too much trouble putting it on or whatever it can be, and it won't be used.
Another important thing also to mention is that the prolonged effect, this 48 hours, we will not see after the first use. So it will take a little bit of time, and these 2 weeks are definitely enough to get them to feel how long the effect could last, which is also part of the efficiency, that we know that they don't have to use it every day in many cases. And then they have to use it for 2 weeks, 1 to 2 weeks, to see that it lasts longer. So we don't see that after the first use. Maybe we see 24 or 36 hours on average. Sometimes we see longer, but on average, we don't see 48 hours after the first time, but definitely after 1 or 2 weeks. We have another question also. Would you recommend that they decrease or other medication during the testing? And I would say no, because we should not get involved in pharma. This is the doctor who has to take these decisions. The doctor has put them on the medication, and it would also, in some sense, make it more difficult for us to show the efficiency, because then they are actually doing something negative in their treatment at the same time as they do something positive. So I would say no. What do you think, Frida?
No, it's the same here. Sometimes we try to time like their Botox treatment when they have the least effect, like 2 weeks before their next injections or something like that, just to make sure that they are not like peaking in their Botox effect while we try this, because we are trying to accomplish the same kind of effects that you do want to do with the Botox.
Yeah.
So that's just something, but we never interfere with the doctor's recommendations or what they have said regarding their treatment. But I mean, of course, when you look at studies, you always try to see what does what. Like you always try to try one thing at a time. That would be optimal, but we would never interfere with the treatments that the patients have from their doctors.
See another question here that is regarding the button in the trouser. That it is difficult with the dexterity or with fine motor function for a lot of our patients to put it on themselves. And it's something that I have seen actually myself also, where we sometimes step in to help them to put it on. So we are aware of this. And in this type of suit that we have now, we haven't found a better way actually to do it right now. And all changes to the suit, they require regulatory changes also. So, but it's something that we are thinking about. And the next generation, we have solved the problem. But when the next generation is on the market, we don't know now. So we're aware of it. But another thing, please be aware that the suit is not too tight. So if it is too tight on the here on the hip, it should be also too tight on the rest of the body and difficult to put on. So really check the size. So it's the electrodes are in contact with the skin, but you don't have to pull the zipper together too much. So it is difficult to close it from the bottom also. So another trick is to not open it all the way when you put it on. So you have a little bit of the zipper closed when you put it on to make it easier to find the button and put it on. But with the dexterity, maybe they need someone who helps them with this task. And of course, if they live alone, it could be a problem.
Yeah. I can see now that we are almost running late. We have 1 minute to wrap this meeting up. If there are a few more questions, we will make sure to gather the information and the answers that you need in an email that we will send out. We will send that out together with some links if you want to read more about the product, and together with contact information to me. So if you are, at least in the Nordic markets, if you're interested in hearing more, want me to come out and have a demonstration, do a fitting day with your patients, whatever it can be, just don't hesitate to reach out and we will definitely make it happen.
I really want to answer the last question also. Have you ever seen that you gave the patient too much stimulation? What is the consequence? So if the stimulation is not pleasant for the patient, we will notice during the first trial, and then we can decrease it, but it's very rare. So it sometimes happens in children that they feel that it's not comfortable in one area, but we will see it at the test, so we can decrease it. So it's very rare that we see that somebody feels uncomfortable because of the stimulation level, because it's very mild. I mean, it's very, very mild. It's just to connect to these 1A afferents. So we know that the currents are very, very small. So if the suit fits well, then we know that it's a big chance that it will not be uncomfortable, and there is no risk for burns. So which is when you use higher currents, the electrodes have to have glue, for example, also, so that we have dry electrodes is also a sign that we don't have any risk of, for example, burns like in other electrotherapy methods.
Great. All right, we might do a 2.0 webinar to continue this. You can talk forever about this.
Yeah, I love it.
But thank you for joining us today, and watch in your email for this information email that we will send out, and don't hesitate to contact us. Thank you.
Thanks. Bye-bye.